Hey everybody, Brian Gallagher here from Meg Business Management and now Meg Academy, because we are virtual 24/7 online for people to get their training all across the country whenever it's convenient for you. No more lost production, no more scheduling patients out and bringing all your staff together, flying me in, flying me out. It's just been such a revolutionary evolution for us within Meg Business Management to have Meg Academy launch. If you haven't learned more about that, please go to our website. You can check that all out. But I'm shooting this video for you because I just shot a podcast that I've been asked to do for a long time, and this is a challenge that I'm finding many of you are really wrestling with. It's the younger therapists in particular, but other therapists as well, not just your new grads. And people are struggling with, how do I properly charge and code for the services I'm rendering? Charging and coding is a very confusing topic for a lot of people. I want to try and break it down for you in a very applicable way. It's just informal. I'm here in my office, so no green screen here. I pulled out the whiteboard. I want to give it to you straight up on how you can do this within your office and coach your clinicians so they can feel confident that they're doing the right thing. So step number one. You must read the AMA regulations on CPT code, which is current procedural terminology. That's what that stands for. If you're going to be good at communicating this to your therapist, if you're going to be good at gaining their agreement, you have to be confident. You have to be confident in what you're teaching them so that they can take confidence away from you and know that you're just not going for a money grab. You're just not trying to, make more money by asking them to bill more units, because that's not what this is about, right? So this is about, number one, getting across to them. The first thing you need to do is get across to them what's the purpose. What is the purpose of this meeting? What is the purpose of this in-service you're giving them? You may even be playing this video for them. The purpose is, as I'm sharing with you, to give an abundance of care. To give an abundance of care. That is the purpose. It's no other reason than that when the patient comes in, you want to keep them 55 to 65 minutes and give them everything you can to help them move along in their condition. That is the reason why we became a physical therapist, is to help as many people as we can with all the skills that we have each and every time we have a chance to get with them, each and every time we have a chance to engage with them. So that is the purpose. Help as many people in our community to the best of our ability. Let me tell you, if a patient comes in and they see John and they got a $40 copay and they're only getting 2 units of care, and they come back on Wednesday and see Sally and she delivers 4 units of care for a $40 copay, the patient's going to figure out quickly that John is not my therapist. He's just like moving me along, shaking and baking me. I feel like a deli. I'm just sitting here being another patient move through the system. I'm going to be with Sally because for that same $40 copay, she's giving me an abundance of care. You got to take that viewpoint. That's what this is all about. Number 2, you've got to talk to your therapist, and if you're a therapist watching this, you got to ask yourself, why did I become a therapist? Why did I become a therapist, and why do I deserve a $70,000 a year salary, $65,000, $75,000? I mean, I see everything in between depending on which coast I'm on, east or west, right? As a physical therapist and as a new grad and as somebody who's been out of school 26 years like myself, I must exchange an abundance with my employer. They're not there to take care of me. They're not there to pay my mortgage and my car payments and that's not the reason why I took the job. I took the job because I went to school to become a doctor of physical therapy and be a professional at what I do. So I want to bring my A game to work every day. If you want to bring your A game to work, it looks like this. You're 85% efficient. So if you're seeing 2 patients an hour for a 40-hour work week, you ought to be able to do about 60 visits a week. Easily. 60 visits a week. 60 to 65 visits a week. That's the number of visits a week you should be able to do with your good patient management skills and your use of the environment. You should have no problem maintaining 85% efficiency. So look at what the maximum number of slots you can have in your schedule per week. Take 85% of that, and as a clinician, I would feel out exchange, out ethics, if I continued to collect my paycheck and I didn't maintain 85% efficiency where I worked. Is that how you feel? Because that's the way you should look at it. If you're going to bring your A game, you're going to be a professional, you're going to pull that off. In the course of doing that, you've got to find the way that works for you so that you can give an abundance of care with each and every session. 3.75 units per visit. You must average 3.75 units per visit. and you must deliver high quality care. None of this comes at the sacrifice of high quality care. None of it. High quality care should be measured by your outcomes. Are you reaching your goals with your patients? Are over 95% of your patients leaving having met all goals, long and short term, at the time of discharge? Or are you just seeing a bunch of discontinuation of cares? A bunch of people are just like dropping off the schedule and you're not seeing them anymore. Not good. Success stories. If the patient's winning, they're going to talk about it. Your goal should be getting testimonials and success stories from patients so you can promote that to the doctors and to other patients. I don't buy anything on Amazon that I haven't read the reviews on, nor does anybody else. So if you're a great therapist, people should be talking about you. They should be raving about you. And number 3, surveys. If your practice is doing what it should be doing, you should be doing new patient surveys, 2 weeks into care or 3 weeks into care surveys, which we call intra-care surveys, and discharge surveys. Those 3 metrics, those 3 measurement numbers should really size up whether you're giving good quality care or not. I can tell you, it doesn't matter to me if all your long and short-term goals are being met, but your patients actually hate their experience. That's why you have to have success story surveys and outcome measures. It really matters what the perception is of the patient. So this is your responsibility as a staff clinician. This is your responsibility to pull this off. If in fact your purpose is in line with what your personal goals are and professional goals as a therapist are, then here's some strategies on how you can do that. Here's how you can maintain these things. Number 1, proper use of techs. For every 2 clinicians, you should have 1 tech, and that tech should read your mind. They should be thinking ahead of what your needs and wants are so that things move very quickly within the clinic. Get you the towel, get you the lotion, move in the ultrasound machine, get you the e-stim, set up the patient, transport the patient. You're never at any point in time billing for what the tech is doing, but they're there to assist you, move your patients, move the traffic, and get you the additional devices you need to be effective in treating your patients. Techs are very, very valuable, and you should train them very, very well. 5 minutes early, 5 minutes late. If you're going to be efficient and you're going to move people through and you're going to do the 12 to 14 visits per 8-hour day like you should, because that's how you get your 85% efficiency, then you need to bring patients back 5 minutes early, keep them 5 minutes late, because with the 8 to 23 minute rule, the only way you're going to get to the number of units that you need to give an exchange in abundance is to make sure you have ample time. You have to have the right amount of time to be able to charge for those services. 38 minutes for 3, 53 minutes for 4. So you need to know that, 23 minutes for 2. So you should all know your 8 to 23 minute rule. The commercial carriers are going to follow the 8-minute rule, or they're going to be a flat rate payer like United Healthcare and Cigna. In many places, they just pay 1 rate per visit. But you still must practice in accordance with the AMA CPT code terminology, but the way you charge and code is appropriate to the services that you're providing and who you're providing them to. So that's all in my podcast. If you haven't seen it, go to iTunes and you should get in there. You'll learn more about that. Point of service documentation, strategy number 3, you've got to learn how to document when you're treating your patients. You've got to explain it right up front in the eval. I will be going around with this laptop and mobile cart. I will be documenting while we're working. It doesn't mean I'm distracted and I'm not paying attention to your care. Quite to the contrary, it gets me even more focused on what we're doing because I'm doing it and documenting it at the same time. This is where techs can help you when the patient's just doing some straight leg raises, the tech's sitting next to them for safety, and you could be documenting while you're overseeing it. Again, I talk about that more in the podcast. So point of service documentation. You should get all your notes done when lunch is over for the morning. You should get all your notes done at the end of the day so you walk out within 60 minutes of your last patient. If you can't walk out of that clinic within 60 minutes of your last patient, either A, you're inefficient in what you're doing, you don't have the systems mastered, or B, you got a horrible EMR system that's too cumbersome and you can't get through it. If you need more help on that, reach out to Meg Business Management. I'll give you some advice on some of the top 5 EMR systems. Untimed services. Strategy number 4. If you're utilizing untimed services, you can be with somebody else while they're on a setup or while they're getting some untimed services so you can be billing for that. That's how you can overlap your patients 1 every half hour, but yet keep them 55 to 65 minutes. 1 at 8, 1 at 8:30, 9, 9:30, 10, 10:30. That is what the top 10% of practice owners do across the country. I am not preaching something to you. I'm not teaching or coaching you on something that the absolute top 10% of practice owners are not already doing. The best of the best have figured out that every half-hour schedule, keeping everybody 55 to 65 minutes, utilizing these strategies is what gives the patient the absolute best experience, keeps the therapist maximally efficient and productive, keeps the community winning, the referral sources winning, and the practice winning. So if that's what you're all about in watching this, then this should be right up your alley. So as always, I want you to get out there and do the best job you can, expect to do well, and apply these strategies. I think you'll find them quite successful.